Hey, Scott. Sorry, I think I called your office number.
Yeah, he did. That's all right. How's up?
All right, cool. So tell me what's going on.
I have a friend that's an attorney. We were just chatting. He had a client that's a friend. Is one of those type of things. She is in an auto accident in March. Is complaining of pain. Then he wanted me to examine her. So she did have a central herniation. So I'm linking that into being an injury. She did not have any continuity of care. No ambulance, no ER visit, and really didn't see her PCP about it. But she's having persistent headaches and like some neck and shoulder pain.
Okay, did she, so when was her MRI?
Within the last few weeks here.
Okay, so
So
you have
inside
March.
of the 6 month rule. Because
Right,
inside of
okay.
6 months.
Okay. So what does the disc look like? Is it desiccated? Is there any other signs of, like, that it's starting the degenerative process?
There's hypertrophy at the at that level. I haven't seen. She has to bring me the disc. She's coming in this afternoon. I haven't seen the actual image. I just have the report so far. I was just looking at the mechanics of it right now.
Got it. Now, where is the hypertrophy? Like facet, you said?
Yes, it's that hypertrophy.
Okay, and how old's the patient?
She is in mid-30s. She's actually 30.
Okay. And what level, do you know? Offhand, do you remember?
Let me bring this up. Michelle, do you have her report there? I closed it out. It is C45 small left central disc herniation, facet hypertrophy noted.
Okay, so what you wanted to, does it say what side the hypertrophy is on? Does it say like left-sided or doesn't it comment on that?
It did not.
Okay, so this is kind of the scenario, right? So when she comes in, you can definitely, discuss that. If you feel that it's proper that you could certainly causally relate it. The facet hypertrophy would absolutely, at her age, particularly if it's unilateral, would be related to the change in disc height, right? So when you have the herniation, you're going to lose disc material between the vertebral bodies, and that's going to move out, right? So when that happens, the facets load up. So she would have an increased wear and tear on that facet or the facet. What I also would be looking for is her symptoms. So referral of facet at C4-5 and 5-6 is going to be the shoulder and like medial scapular border.
Yep.
So part of the history, I would be asking her, does she have pain there? Does she get pain into the shoulder? Then, if that in fact is true, and that was what she had experienced since the accident, then you can causally relate all of that. So you don't, the gap of care will have to be addressed, but you can discuss what she may have done at home. If there was any times that she actually missed work, if she was icing, any of those things that would have, sort of lended itself to self-treatment.
Got it.
Okay, but the key will be the MRI. And did you order that, or did somebody else?
I ordered it.
Okay, perfect. Yeah. So I would just go off that as long as it correlates, and you know how to date the injury, and it's within that window. You could definitely causally relate that.
Okay, and I don't see this on the MRI a whole lot, but they did comment about C23 minimal anterolisthesis, so I should probably ship her for flexion extension as well.
Yeah, you would want to quantify that. Now, that was on the MRI, they said that?
Yeah, I don't see that.
Okay, yeah, so remember, right, like that's because she's lying down, right? So you would expect flexion extension views to definitely be more significant. And then I would look really closely around those radiographs too, because you should probably have started to see some degenerative change as well. And then you can shift that out to, you can either digitize and measure it yourself or send it to Dr. Weekend.
Got it.
Okay?
Yep. Got time.
Good. That's a good case. So these are one of those cool things where all the little pieces of all the stuff that we've all learned all come together.
Yeah, man.
All right?
You got time for another question?
Yeah, of course.
The ortho spine guy, his people finally called me back after I kind of got, not pushy, but I was like, look, I need to know if you guys are cool with this or not because I'm going to have to move on. So they're like, well, you can come this Thursday, Friday. I'm like, well, okay, looks like I'm moving patients around now because I got to get this shit done.
Yeah. No, and that's exactly how it works. So like when you're setting up meetings with surgeons and all of that, it's typically going to be no response, no response, no response. Hey, can you come down tomorrow?
Right. Yep.
You know, that's why as you grow and you finally get an associate in, then you'll just say, hey, listen, you got to see my patients well done. You know, that'll be the next step. But yeah, let me know how it goes. Okay.
Thanks, Bill. Appreciate it.
All right, you got it, buddy. Bye.